TMH Transition Center patient Brian Owens has a reason to smile.
Oh, I'm doing a lot better. I can dance if I need to.
But months earlier, it was no laughing matter. An open wound sent Owens to the ER, where he was treated and released. However, his condition worsened. Without insurance, Owens was referred by ER clinical staff to the transition center, where lab tests would soon reveal his wound had been infected with MRSA, a bacterium that can be difficult to treat because it's resistant to commonly used antibiotics.
When I came here, they took cultures, and they looked at sensitivities and found out what I was taking at the time wasn't even helping. So they got me on the right antibiotic, which really made a big difference.
Transition Center physician Dr. Stephen Quintero says Owens and other patients are benefiting from a relatively new process.
In the whole country, there's only a handful of centers that are doing this, and as we see the good results that are coming of it, we hope it'll spread.
So what exactly is it the Transition Center is doing? To put it simply, the center is a safety net for patients who have been discharged from the hospital and are at high risk for readmittance. High risk, Dr. Quintero says, because a hospital stay comes as a surprise to most patients.
When they leave, they're left with all this, what do I do next? They often get instructions that can be confusing. They don't know where to go. They can't afford to go where they need to go. They can't afford their medications. Often they have insurance and can't get into their own physician in a timely manner, but they need something done.
TMH Chief Medical Officer Dr. Dean Watson says this is where the center steps in, opening its doors to those who often find them closed.
This clinic allows us to see these patients without concern related to payment, to insurance status, disease process. We see everybody.
As a result, the center is seeing a drastic reduction in the readmittance of hospital patients, as well as a 61% reduction in ER visits and admission, and a 68% reduction in total inpatient days. Dr. Watson says this alone tackles a major issue.
The cost of health care increased, the demands on the emergency department and the hospital itself, including resources that are limited, as we all know.
The center's nurse practitioner, Judy Griffin, says the staff not only provides medical care, but helps patients in other areas, such as filling prescriptions, arranging physical therapy, and connecting them with social workers.
They leave with the feeling that these people did help me and they want to help me, and that gives them, I think, incentive to continue to take care of themselves and seek out health care when they need it.
A sentiment echoed by the many patients of the TMH Transition Center.
We were very frustrated, and thank God that there's a place like this, and I don't know what we would have done if it wasn't for the Transition Center.
Without the Transition Center, I really don't know where I'd end up, but I know it wouldn't be a good place. They pretty much threw me a rope, said, hang on, here we go, and they were wonderful.